tongue tie is a description of the connective tissue right underneath your tongue, that sort of anchors your tongue to the floor of your mouth. And we expect that your tongue is going to be able to do lots of different things. And if it is anchored in any position, it gets harder to do some things. Very specifically in this report, it gets harder to breastfeed. And so when babies are breastfeeding, they need to be able to extend their tongue and elevate it in order to transfer milk into their mouth. And if there is a piece of connective tissue underneath the tongue, it makes it harder sometimes to extend and elevate, which makes the breastfeeding painful or sometimes less effective, or both. There have been dentists that have gotten involved and will, with a laser, go in and get rid of that connective tissue. And they feel like they have seen good results in terms of preserving breastfeeding relationships. They do it for a lot of different reasons. The practice got to be very common without a lot of good data. And we got very concerned that this was being done really without a lot of input. In fact, in many cases, without any input of the pediatrician. I think we're seeing more and more that the focus is just becoming on sort of the baby's mouth, when there is just so much more that needs to be considered when we're evaluating feeding problems and breastfeeding issues. And so the people that are best qualified to do that are the pediatricians. And if there is a concern and we need specialists, we will create that team around the family to help them be successful with breastfeeding.